Hi there. Welcome to The PrevenTable, the podcast giving you a seat at the table with conversations about the intersection of alcohol, drugs, and mental health in everyday lives. Take a seat and join us.
Welcome to The PrevenTable. So with me today is one of my favorites. And I feel like I say that every time, but this time it's true. So Pooja has joined me today. Hi, Pooja.
Hi, Nicole. How are you doing?
Good. And we're going to talk a little bit about who Pooja is and why she's on this darn podcast. But I think I'll just give like the overview and then we'll like dive in. So Number one, you are a senior in high school, right? Okay, cool. You have like a path picked for yourself already, which I want to get into, which is pretty amazing. Also, full disclosure, you're on our board. Right. Oh, yeah, I know. I guess there's, like, I'm supposed to do that. I don't know. It feels more official when I say full disclosure.
Yeah, I just never think about it, honestly.
You are our teen representative.
Yeah.
And you've been that since, like, May?
Since May, yeah. May was my first meeting.
So how am I doing? Because, you know, technically you're my boss.
Really good. I'm understanding everything. Maybe not so much the money stuff, but
okay. I don't understand it either. Kidding. No, it's weird, right?
It is. I just get really overwhelmed. I'm like, okay, this is cool, but I think it's really cool to see what goes beyond a nonprofit. Just like not the work that they do, but there's a whole layer of information beyond that. It's just like really eye opening because I wouldn't have expected it. Like.
And
it's a full deal.
It's a real deal.
Yeah.
You know, I mean, there are some people that maybe don't do the real deal, but like we're like an actual nonprofit, and you care about learning about this because you want to start your own nonprofit, or have you already?
I'm in the process, so filling out those applications and papers and all the nitties and
amazing like 501c3 forms and everything.
It's confusing, like, as a 17-year-old looking at it, but I have people there to help me along the way.
It's confusing as a 40-year-old to figure it out.
Right.
So tell everybody, like, why do you want to start a nonprofit? Like, what's your deal?
Yeah, so since June of last year, I've been working on a Naloxbox initiative, and what that is placing naloxone in our high-risk communities around St. Louis city and county. And what these boxes do is that they offer access to Narcan, which is the drug that, like as you can see on my shirt, but you guys won't see on the
shirt.
on the podcast. It's a medication that saves lives and gives time necessary in those overdose situations. So these boxes reduce the stigma around substance use as well as increasing user access in those overdose situations. And so I've been working with police departments. I've been in contact with public libraries, and I'm just trying to talk to as many communities as I can to put these boxes up. So that really takes mobilizing as many people as I can, like Prevent+Ed, who has given the wonderful opportunity to work with people who I align with, like philanthropically and kind of politically, to give a voice to those who really need it, you know?
Yeah. So break it down for me. So how much does one of these boxes cost?
Yeah. So right now, just the box itself is $250.
And is it like a mini library? Like I'm like for people who have never seen one of these,
right.
Like describe it.
Yeah. So think of an AED box, right? Like that has what you need in those kind of situations, but take that for an overdose situation. So it's really simple. Has Narcan, 2 doses of those, so you can, if the first dose doesn't revive the individual, you have that second dose to rely on. It has a rescue breathing kit, so that's like CPR, so you can perform it on the person, as well as an instruction of like how to use it and how to administer Narcan. Very simple. And
is it inside? Is it outside?
So it's a polycarbonate box, so you can see right through it. So it's kind of like a fire extinguisher box if you're looking at it. Like, you see the fire extinguisher inside of it, so similar to that, the Narcan's in there. To give a rundown on how it works, say someone has overdosed down the street, and at your local restaurant up the street, there's a Naloxbox. So what you can do as a bystander is run up to one of these boxes. It is free to anyone, so anyone can go up to the box and take the medication.
Because theoretically you would have it on your person. Like, you would have it, but not everybody does. Right. And some people, you know, like, it doesn't just fit in your pockets. So if you don't have it, you run up to the box, and is it like break, or you just open it? Or
you break the seal, and you can take the medication and get back to your person who has just overdosed. And what it does is it really cuts down the time in overdose situations, because time is crucial, and we really need to increase resources so that we can decrease the amount of morbidity and deaths that are happening in these situations, because the time it takes for a emergency responder to get to you is going to be far longer in these high-risk areas than it does for a bystander to get that medication and be back. So it's really crucial to have these resources, because there is that lack right now in these communities.
So, okay, so let's say that I'm in my neighborhood, I don't have Narcan on me, but I see somebody experiencing an overdose. I do exactly what you just said. I go to the box, I open this, whatever.
Yeah.
How does it get refilled?
Right. So what I'm working with is coalitions like Prevent+Ed and Heal, Stop Heroin in St. Louis, as well as partnering with assisted recovery centers like ARCA to resupply these boxes. So as the quote-unquote medical director, I would go and replace these medications, still outlining for future, like, what it looks like once I go off to college. Like,
Correct.
who's going to take over. Hopefully groups like Elevated or like Rockwood Coalitions and other coalitions in the area would be able to kind of mobilize support from everyone.
That's an awesome idea. Okay.
So then everyone is still, it's like not just going away. It's like, oh, no, like it's.
Yeah, because you don't want your work to end with you.
Yeah.
Like you want it to keep going.
And it shouldn't, because as a generation, we need to keep bringing youth and bringing these conversations, because it isn't just about the box. Yes, it's the resource, but it's about having these conversations and engaging people to keep caring, because that's what we need. We need to
people need to give a crap.
Right. And I feel like when just in general, like whenever we as a generation talk about something, it requires everyone, not just the individual. It starts with having that difficult conversation and then getting support from others. Like how I started was, I have a voice as a 17-year-old, and at least how I started this project was, who can I talk to? Like, who was the first person I could talk to? So I talked to professors at local universities, and they were like, okay, well, we can help you only so much. You should start talking to prevention
because
offices.
this didn't exist in Missouri until you brought it here, correct?
Yeah, so
that's kind of a big deal that you just glossed over.
Yeah, so
and did you find out about, how did you find out about what was happening in other states?
So I was like, there is a gap between resources and well, first of all, to back up, I think it's important to back up, because why do I care? So, I think that's really.
Do you want to host this show?
I think that's a lot of.
No, you're like forming your own nonprofit. I'm pretty sure you can handle it. Go ahead.
Yeah.
So why do you care?
And this is actually interesting enough. Like, I had a conversation in the middle of class. I got a phone call. I was like, who is calling me in the middle of
Yeah,
my
right.
stat
Don't they
class?
know I'm like...
Right. And it was a police officer actually asking about, like, the Naloxbox initiative, because I had called him earlier that day. And I was like, okay. And he said to me, Pooja, I wouldn't be doing this as a 17... Like, what makes you care so much? And I had to think about it for a second. And what I ended up telling him is because I do. But the real reason behind it was because... when I started getting into it, because of a family member who dealt with substance use disorder, and then it kind of took me into the spiral of learning about the opioid crisis, and I learned about how the CIA was involved in LSD in our country, and I learned about all these different facts and how it's created this cycle of generational trauma and, like, our punitive system that's been built on putting individuals in jail for crimes that really shouldn't be put into jail for, like recidivism. That was the word I was looking for. But yeah, this cycle, like, of poverty and all these different things. I was like, I have not aligned. Like, it really caused me to align myself with others and see their perspectives. And because of that, I was like, we need change. Like, okay. So then that was like the why I care part. But then I started looking at, like, Rhode Island, like Brown University. And there was a professor, Dr. Caparo, forgive me if I'm saying that wrong, but he started the Naloxbox initiative. I was like, this is really cool.
Yeah,
like,
for sure.
This. And from there I was like, okay, so what are we doing in St. Louis? And then, so that's when I started talking to professors, and then I reached out to PrevenTable on an email, and you guys took a bite with me, and and it really.
And we were like, "Who is this person?" And she's amazing. And yes, let's figure out how we can support her because we don't do. I mean, you're doing it. We're literally providing like a landing pad, but you're doing everything.
And it definitely like is going at a slow pace right now because I'm working as one. I'm trying to get more support with other people, but it's a slow process. But it's getting there. I'm
wondering if like people want to help. If they're listening to this and they don't want you to be the only person doing it.
Right. So that would be awesome if you're out there.
Okay. All right. So you're looking for teens or adults or decision makers, people who want a Naloxbox or want to help replenish or any of that.
Definitely. So, so I started, so you guys took a bite with me and then it all went from there and I started doing like different campaigns with you guys, and then that with Landon I was introduced to HEAL and all these other coalitions, and then from HEAL I was introduced to ARCA, and it was just like a whole web of support that I was just like, whoa. Like I was a little bit overwhelmed at first until I like
we can be a little overwhelming, but
it's just to have like nonprofits like Prevent+Ed that are so intertwined, like not only with other coalitions but also with political like legislators and representatives. Like when I signed up for the legislative forum, I was honestly in the middle of class at home, but I may or may not have just turned down the volume a little bit. And
if you're one of Pooja's teachers and you're listening to this, please disregard.
This was last year. I was online, so please
exactly.
forgive me. But but it was a really cool opportunity because I didn't realize how many senators were there and how many representatives. I was like, Joe Shoup, Holly Rader, and just so many. And I was just like, the fact I got to ask a question about how we can mobilize youth to have these conversations and just be able to present that, which is really unique and cool because it helps me build this perspective, build this mold that I kind of look at the world. And
then you just kept on going because you were one of a group of young people who I think that you all were the linchpin that finally got the prescription drug monitoring program passed because Holly Rader did a lot of really amazing things and there was something missing to try to get people's opinions to change.
Right.
I had the privilege of being on some of those calls with you and the legislators and your cohorts and I don't know. I feel like they were convinced. So thank you for that.
And I think it really takes not just having that conversation at a local level, but seeing that there needs to be a greater conversation at a state level, making policy changes, because it's definitely something that is different, but it allows you to kind of speak to those who have power to make change at a systematic level, because that's where change needs to actually start. Like we can start at a local level, but we got to move to a state level to actually see for next generations like outcomes, like cause that's where it starts, you know.
So I want to come back to politics in a second, but so how many boxes do you have up right now?
So I don't have any boxes up right now, but I do have 11 boxes purchased, and they are fully supplied. It's just a matter of, right now, people saying yes and just putting them up. So
what are the barriers to putting them up that you've experienced? And, I mean, if somebody, wants to, is listening to this and they're like, I want one up at my gas station or my restaurant, I mean, we could just... They could connect with us, and we could get them to you. Is that correct?
Yeah.
We have 11 ready to rock and roll.
Yeah, there's really no barriers when it comes to it. It's just purely having we have a document, like a memorial of understanding, and that's just saying that if someone uses the box, you are going to tell me, first of all, like, it was used. You don't need to tell me any other information.
Yeah.
Just that it needs to be refilled, and then I'll come and do that, or whoever
So then
takes
why
over.
are people putting them up?
It's hard. I've been making phone calls, sending emails.
But you're one person.
It's one person, so it's hard. And people are like, I'll come back to you, and then having those follow-ups, and then it just kind of falls through.
Meanwhile, we just need you to put it up.
Yeah, it's just like, I'm just like, who's going to take the bite? But I had a conversation with my counselor about this, funny enough, the other day, and he was like, you just have to make room for yourself at the table. You know, like someone
That's right.
Someone will take the bite. It might take a little bit of time, but hopefully sooner than later. I'm trying to, hopefully, fingers crossed, by the end of October, at least one.
Okay.
We'll see, but...
Well, I have a feeling that if people are listening to this and they, run a restaurant or a convenience store or a, even like a packaged liquor store or something like that, like those are the places that, potentially could be really great for these, correct?
Correct.
Awesome. Okay, so I want to come back to you for a second. So you plan on doing pre-med and saving the world medically. Is this correct?
I do want to go into medicine, yes. I feel like I've always been fascinated with science, but I think more so recently what medicine has evolved to, at least, is being an advocate. I feel like I'm really action-oriented that way to being an advocate. So I not only want to advocate for their health, but like seeing them more holistically and being able to treat them as an individual, more human-to-human connection as a physician. So,
are you sure you don't want to consider politics? Because I don't know, but I'm thinking Pooja for president has a very nice ring to it. And like, would you have to be 35, right? But and hey, like you could be a 35-year-old physician president. I mean, you'd just be about finished with med school, right?
Right,
you could just go straight into politics. Seriously, consider it. I'm not joking. Okay. I think our political system needs more people like you.
Right.
So, do you have a like a nonprofit email or something like that set up rather than your personal email?
Yeah, it's the opioidproject.info@gmail.com.
The opioidproject.info@gmail.com. So if you want to learn more about the Naloxbox project, you want to tell Pooja how amazing she is and that you'd vote for her too, or you want to join because right now you're one person, right? And you will graduate and go somewhere, and so you'd like to see your work continue.
Yeah.
Wow. Anything else about your project that you need people to know?
I mean, I guess if I'm going to shout out like the Instagram that I have,
do it.
It's at the Opioid Project on Instagram. So
at the Opioid Project on Instagram.
Yeah.
All right. Pooja, thank you so much for joining.
Thank you, Nicole, for having me.
People freak out about the next generation, and I think that when they listen to you and your peers, I think hopefully you're sitting at home or watching this just thinking like, the kids are all right. And we're going to be all right because Pooja's going to run for president someday and take care of us all. So if you want more conversations with people like Pooja, please consider liking, subscribing, reviewing the PrevenTable podcast. Thank you so much. I'll see you at an upcoming board meeting.
Thanks for joining us at The PrevenTable, brought to you ad-free by Prevent+Ed. Prevent+Ed works to reduce or prevent the harms of alcohol and other drug use through education, intervention, and advocacy. Please visit their website at PreventEd.org. Like what you heard? Rate, review, and subscribe to stay up to date with what we are serving on The PrevenTable.